the lecture covering a comprehensive insight on different types of dosage form. As already discussed, the dosage forms are classified based on either their physical state or on the basis of route of administration, or a combination of based on physical state and route of administration. So talking about the classification based on physical state and route of administration, broadly, the dosage forms are classified into liquids, semi-solids and solid dosage form. The liquid dosage forms are subcategorized into monophasic and biphasic systems. Biphasic system or biphasic liquid dosage forms are two-phase systems having two phases, wherein one phase can be a liquid or a solid and the second phase is a liquid. The typical type of classification under biphasic liquid dosage form is again based on either the system being liquid in liquid or the system being solid in liquid. So first, talking about the system biphasic liquid in liquid type can be categorized based on route of administration into the oral use or external use. Biphasic systems liquid in liquid meant for oral use covers emulsions. Emulsions are biphasic, thermodynamically unstable, heterogeneous systems containing two immiscible liquids, wherein one of the immiscible liquid is dispersed in the other and the system is stabilized by an emulgent. Example, liquid paraffin emulsion. Biphasic systems liquid in liquid meant for external use can be liniments. Liniments are liquid or semi-liquid preparations applied to the skin and generally used as counter irritants. Example includes turpentine liniment, official in Indian Pharmacopoeia. Liquid in liquid biphasic systems meant for external use also include applications. Applications are either liquids or semi-liquid preparations intended to be applied on the skin. They are used to retain the drug in contact with the skin for prolonged period of time and are generally applied on larger portion of skin. Example, benzyl benzoate application, official in British Pharmacopoeia. Now, biphasic liquid dosage forms which are considered to be taken orally, that is solid in liquid type, include suspensions. Now, suspensions are mixtures containing insoluble solids, heterogeneous in nature, thermodynamically unstable systems having insoluble solid particle which is uniformly distributed in a liquid phase with the help of a third ingredient, suspending agent, and this serves as a physical stabilizer. The example includes magnesium hydroxide mixture, official in British Pharmacopoeia. The second type of biphasic liquid systems, solid in liquid type, are intended for parenteral use, and the biphasic liquid dosage form which are exclusively used externally include lotions. Lotions are solutions or suspensions and generally are termed as shake lotions, and they should be applied without massage on intact skin. The popular example under this is calamine lotion, official in Indian Pharmacopoeia. Talking about the second class under the third type of classification of physical state and route of administration, we have solid dosage form. Under this, the first type includes meant for internal use. Under internal use, either gels or jellies can be used. Gels are transparent to opaque semi-solid systems, either being suspensions of small or large organic particles dispersed in a solvent, forming a three-dimensional colloidal network structure. Gels are more rigid compared to jellies. The second type of semi-solid dosage form generally intended for internal use are jellies. They are typically same as gels, the only difference being that they contain more fluid and have less cross-linking as compared to gels. The semi-solid dosage forms which are intended for external use could be ointments, pastes, creams or poultices. Ointments. Ointments are semi-solid preparations with or without the medicaments and are intended for external applications only. Example includes sulfur ointment. Semi-solid dosage form meant for external use, creams. Creams are semi-solid emulsions which are intended for application to the skin or mucous membrane. They are less greasy and easier to apply. Example, citramide cream, which is official in British Pharmaceutical Codex. Semi-solid dosage form meant for external use include poultices. Basically, they are ointments containing high percentage of insoluble solids, generally 20 to 50% or higher. They are having good adhesion on skin and they form thick coat. They are generally stiffer, less greasier and more absorptive. Example, Unna's paste, official in Indian Pharmacopoeia. Talking about semi-solid dosage form meant for external use, poultices, which are viscous, pasty preparations and are applied as hot to the skin to reduce inflammation and act as counter irritants. Poultices possesses the properties of heat retention and absorption. The most common example includes kaolin poultice. Coming to the third categorization under the last type of integrated classification based on physical state and route of administration covers the oral route. They are powders which can be used as such. Powders can be divided powders or bulk powders. Divided powders are generally potent drugs are administered as divided powders. They are dispensed as divided powders can be simple divided powders which include a single ingredient, or it could be compound divided powders which includes mixture of two or more active ingredient. Talking about solid dosage forms used as such for internal use or oral use can also be under bulk categorization. When we talk about divided powders, they are potent drugs and are generally dispensed as divided powders. Divided powders can be administered as simple divided or compound divided powders. Simple powders are generally having single ingredient and compound divided powders are having more than one ingredient. When we talk about bulk powders, they are generally for non-potent drugs and are dispensed in bulk containers. They are generally either effervescent type or non-effervescent type. Non-effervescent type includes kaolin powder and effervescent type includes effervescent granules. Solid dosage form which can be used as such and meant for external use are generally dusting powders. Dusting powders are dusted externally on the intact skin. The other type can be insufflations. These are fine powders intended to be introduced into the body cavities such as ears, nose, vagina or the throat. Also externally, the powders can be administered as douche applied in vaginal cavity after dissolving in warm water. It could also be a dentrifice. A dentrifice is composed of abrasive agent and surfactant and especially intended to clean or polish the tooth. The final type under solid dosage form meant for parenteral use. Talking about the first type under compressed form includes tablets. A tablet is a unit solid dosage form prepared by compressing or molding a drug powder with or without additives. The tablet can vary in shape, size, weight depending upon the amount of drug and intended mode of administration. The tablet can be swallowed, chewed or placed under the tongue or kept in the cheek pouch. The tablets are of different types. Either ingested tablet. An ingested tablet can be single or multi-layered. It could be coated, dispersible, soluble, chewable or controlled release type. Generally, A tablet is kept in the oral cavity, which could be either sublingually or buccally. Tablet can also be placed in body cavities as suppository and pessary. Sometimes a tablet could be implanted as a sterile preparation. The second type under compressed type of solid dosage form includes capsules. Capsules are dosage forms containing a drug enclosed in a hard or soft gelatin shell called capsule. The shell dissolves or disintegrates in water to release the medicament completely. Example, chlordiazepoxide capsules. The third type under compressed type includes cachets. Cachets consist of dry powders which are enclosed in a shell, and these shells are made by molding rice paper. The third type under solid dosage form includes molded type. Under molded solid dosage form, the first includes tablet triturates. Tablet triturates are prepared by molding a moistened blend of potent drug and diluents with dilute alcohol as moistening agent. Tablet triturates are used generally for sublingual or oral administration. Example, paracetamol tablet triturate. The molded type of solid dosage form also covers lozenge or the suppository. Now talking about suppositories, suppositories are solid or stiffened forms for insertion into body cavities like rectum, vagina or urethral tract. Suppositories melt at body temperature and soften or dissolve or disperse in the body fluid. If a suppository is inserted vaginally, it is referred as a pessary. If a suppository is given through urethra, they are referred as urethral bogies. And if a suppository is inserted into the ear, it is referred as ear cone. And if through nasal cavity, it is referred as a nasal bogie. Example, through rectal route includes glycerine suppositories official in Indian pharmacopoeia. The next type of categorization under molded solid dosage form is a pill. Pills are small, spherical or oval shaped solid dosage form. They are intended for insertion into the body or for internal use. Generally, a pill weighs 60 to 300 milligrams and sometimes it can go up to 2 grams. Now 2 grams is generally intended as bolus for veterinary use. The typical example under pills are throat pills. Finally, we have under molded solid dosage forms lozenges. Lozenges are round, discs, oblong, triangular or rectangular shaped solid dosage forms. They are intended to be sucked and are generally prepared by using compression mechanism, and these disintegrate to give viscous liquid which are produced in the mouth, and it helps to retain the medicament on the affected area for longer period of time. Example, benzyl choline lozenges, British Pharmaceutical Codex. So in conclusion, finally, having known the classification and having understood the type of dosage form based on different ways of classification, and having introduced to each type of dosage form exclusively, it is very important that as a formulation chemist, a given active pharmaceutical ingredient or a drug has to be devised into a dosage form. So the science behind developing a dosage form is a very creative work. Also, it helps in development of a given API or a crude drug into a new drug or a new formulation. Dosage form development helps in improvement of already existing formulations or products, and the main purpose of having the science of understanding a dosage form development is to build a formulation with best therapeutic efficiency. In conclusion, all the dosage form having been introduced in this introductory lecture are also referred as conventional dosage form. The only limitation of having these conventional dosage form is that it needs frequent dosing in order to achieve best therapeutic effect, and as frequent dosing is required, it ends up in showing fluctuation in blood concentration. In order to overcome this, in our subsequent series, we will be talking about the extension of conventional dosage forms as novel drug delivery systems, which will help us to cover up the limitations of the conventional dosage forms. So it is quoted that if medicine is the heart of public health, pharmacy is the brain to stimulate it. Thank you.